Hello everyone, welcome to my channel. Today's video is about, as you can see, nephrotic and nephrotic syndrome. So let's start. Nephrotic syndrome. Nephrotic syndrome is more common in children, and affected age group is 2 to 6 years old children. Most common cause is minimal change disease (MCD), especially in the children under 10 years, and presentation is basically facial puffiness, frothy urine, and swelling are typical. Prognosis often responds well to steroids, and relapses are common but manageable. Nephrotic syndrome is also a children's disease and more common in adolescents and adults. Peak age is adolescents to middle-aged adults, 15 to 40 years, but can occur at any age. Common causes: post-infection glomerulonephritis (PIGN) in children and young adults, IgA nephropathy and lupus nephritis in teens and adults, rapidly progressive glomerulonephritis (RPGN) in older adults. Presentation is blood in urine, high blood pressure, and reduced kidney function. Prognosis depends on cause. Some forms can progress rapidly in kidney failure. So here is the comparison between nephrotic and nephritic syndrome. In short, main issue in nephrotic syndrome: massive protein loss in urine, heavy proteinuria, hematuria rare and absent. But on the other hand, in nephritic syndrome, inflammation on glomeruli, proteinuria is mild to moderate, hematuria is common, microscopic or visible. Here are some more features like nephrotic. Edema is especially facial and peripheral. Blood pressure usually normal, urine output normal or increased. Urine analysis findings are frothy urine, protein is more common passing through urine, and lipid levels are elevated, that is hyperlipidemia. On the other hand, nephritic syndrome, there is edema is mild to moderate, blood pressure is often elevated, urine output often reduced, that is called oliguria, and urine analysis findings are hematuria is present, blood cells cast, and protein is comparatively less in urine, and lipid levels normal or mildly elevated. Let's go to the next topic. Next features are coagulation risk. On nephrotic syndrome, it is increased, and common causes are minimal change disease, FSGS, membranous nephropathy. Treatment focus: reduce proteinuria, manage edema and lipids. On the other hand, in nephrotic syndrome, we see that its coagulation risk is not typical. Most common causes are post-infection glomerulonephritis, lupus nephritis, IgA nephropathy, and treatment focus is control the inflammation and manage hypertension. So what are the clinical parts? Nephrotic syndrome is more but leaky filters. The glomeruli let too much protein escape, leading to swelling and metabolic issue. On the other hand, nephrotic syndrome is more about inflamed filters. The glomeruli are damaged by immune process, causing blood in the urine and reduced kidney function. So which one is more dangerous? Both nephrotic and nephrotic syndrome can be serious, but nephrotic syndrome is generally considered more immediately dangerous due to its potential to cause acute kidney injury and rapid loss of kidney function. So why nephrotic syndrome can be more dangerous? Here are some points. That is, inflammation of glomeruli can severely impair filtration, leading to oliguria, low urine output, and azotemia, buildup of nitrogen waste. Hypertension and fluid overload can cause complications like pulmonary edema or heart failure. Hematuria and red cell cast signal activate the glomerular damage, which can progress quickly. It may be part of system disease like lupus or vasculitis, which carry additional risks. But nephrotic syndrome has its own risk. Massive protein loss leads to edema, hyperlipidemia, increased risk of blood clots, renal vein thrombosis, pulmonary edema, is the examples, and infection are more common due to loss of immunoglobulins in urine. Chronic nephrotic syndrome can lead to progressive kidney damage over time. So here's the summary. Nephrotic syndrome is more acutely dangerous due to inflammation, hypertension, and risk of kidney failure. And nephrotic syndrome is more chronically dangerous due to metabolic complication and thrombotic risks. So here is the end of the video. If you like this video, please do not forget to subscribe, and thanks for watching.